Hello everyone, welcome to my channel, and in today's video I'm going to discuss another very important topic for PLAB 2 or ukmla osce, and this is known as mastitis. So as we all know that mastitis is basically an infection of the breast tissue, commonly occurring in breastfeeding mothers. So most probably, our presenting symptom will be pain because pain is the most common presenting symptom of any inflammation. And it can be accompanied by the patient might say there is some swelling, there is redness and warmth, but the the symptom that it is causing the patient to present to the hospital is most often pain. So, in our data gathering part, we are going to start with Socrates because it's a pain complaint. So, we'll ask about the exact side of the pain, which breast, is it the right, is it the left, and when patient tell you, doctor, it's the right breast, you must ask about the other breast as well. Is it unilateral or bilateral? This is a very important question, okay? And then the onset of the pain, was it sudden, was it gradual? um Character of the pain. So, was the pain sharp? Is it dull? Can you please describe the pain for me? Is the pain going anywhere? Which is radiation, any aggravating factor, any relieving factor, any treatment that the patient has taken, and the severity of the pain. So, we'll ask the patient, how will you score your pain on a scale of 1 to 10, with 1 being no pain and 10 being the worst pain that you have ever experienced. Okay, so you will explore the pain by asking Socrates questions. Okay, then we will go to other complaints. So first of all, you will ask the patient an open-ended question, any other symptom apart from the pain, and then you will ask close-ended question, like any breast swelling, any redness or warmth, any lumps at all, any overlying skin changes. So these questions are important because you are kind of trying to exclude other breast diseases. So any lumps, it could be fibroadenoma. You can be excluding fibrocystic disease of the breast, and can be um, presenting symptom of cancer as well. So when you're asking about lumps, you are trying to exclude all those other benign and malignant breast diseases, okay? And your lying skin changes. So in case of a simple mastitis, the skin is going to be red, okay? But in case of, for example, purely orange appearance of the breast, which is because of a carcinomatosis, the patient will tell you it's like an orange peel, or there is flakiness of the skin. So this is also keep in mind to ask about overlying skin changes as well. This is a really important question. Any lumps anywhere else in the body, like for example, axilla, because if the patient is having lumps in the axilla, in mastitis, it can be because of infection. So it can be reactive lymphadenopathy. But if it's like painless lumps in axilla, uh, in association with lumps in the breast, it could point out towards breast cancer as well. Other red flag questions like any weight loss, any discharge from the nipple, and we'll ask the patient if she's currently breastfeeding because this is a risk factor for mastitis, and then ask about any fever or chills. Okay, so if the patient is also having fever and chill, then it means that the infection is it's going towards an abscess. The infection is quite widespread, and as the patient is having systemic findings now. Okay, so this was your history of presenting illness. Then we'll ask about past history, and this will include your ops gynae history and past medical history as well. So in ops gynae history, we'll ask about recent delivery, number of children, previous history of breastfeeding, and any complication. Because this is like mastitis is more common in patient who has when it's their first baby and they're not really sure about the correct technique of breastfeeding, and they're not able to the breast is not able to drain properly because they're not following the correct technique of breastfeeding, and the ducts are getting clogged up, and because of that infection can settle in. Okay, so make sure to ask about previous history of breastfeeding, whether they are sure about the correct, whether anyone has explained to them the correct feeding techniques. um And then in past medical history, you are going to ask about any previous episodes of similar symptoms before, any other problem. For example, if the patient has been diagnosed with, for example, fibroadenoma, fibrocystic disease, ductectasia, etc., and any recent injury. This is again quite important because a similar presentation can happen after an injury as well. So make sure you ask this question to exclude this as a possible cause of the presenting complaint. Okay. Then meftosa, which is any medication that the patient might be taking, any allergies. Allergies again very important because you are going to prescribe antibiotics. Family history of any breast disease, and then psychosocial, you can ask about what job the patient is doing, if it's like a recent delivery, if it's like the first time baby, then ask about how she's coping with this new change in her life. So this will be all about psychosocial. And then in lifestyle question, which is cigarette, alcohol, food, and exercise. Cigarette and alcohol are quite important because smoking also can predispose to a variety of breast diseases, including ductectasia, and smoking and alcohol are not recommended if person is breastfeeding. So these two questions and lifestyle are very, very important. And food and exercise here are not much relevant. And then we'll go towards ideas, concerns, and expectations. So we'll ask the patient, um, what do you think might be the cause of your pain? Anything that you are particularly concerned about? With um, breast pain, swelling, and redness, most ladies will be concerned about breast cancer because this is what they hear in media that it's like breast cancer is very prevalent. So the first concern that might arise in the patient's mind is, could it be cancer? Okay, so and as a patient is breastfeeding, so she can think, is it safe? She can be concerned about the health of her baby. She might worry, is it safe to keep on feeding the baby if she's having an infection? Okay, so these can be some of the concerns to look out for. And expectations, so we'll ask the patient, what were you hoping we could do for you today? And then examination. So examination is quite important here. So I would advise you to watch videos on breast examination and learn it properly, because if you get a combined station, then you will need to actually perform the examination and pick up the findings rather than just verbalizing the examination and examiners giving you the positive findings. So make sure that you really learn breast examination. And then in the management part, you will start your management by explaining the diagnosis to the patient. So you will tell the patient that mastitis is actually an infection of the breast tissue and it is common in breastfeeding mothers. We'll do some blood tests to confirm, and it will include your full blood count, your inflammatory marker, and also culture of any discharge if it's there. If the patient is running fever and is having chills, then you might as well do a blood culture. And then you'll tell the patient that I will prescribe antibiotics for you to clear the infection. And for pain relief, you can take paracetamol or ibuprofen, and they will also help reduce the swelling and the inflammation. Explain to the patient that breastfeeding is safe to continue and it's actually recommended to continue breastfeeding because it can help relieve pressure and clear the infection faster, and try to keep feeding from the affected side. But if feeding gets too painful, then they can, for example, use breast pump to express the milk to help relieve pressure. Okay. Um, Also advised to apply warm compresses to the affected area, keep themselves well hydrated, and make sure to rest. So all these supportive kind of measures. And then you will need to safety net this patient about the development of breast abscess. So you need to tell the patient that if you feel that the redness and the pain is increasing or there is formation of a lump, please let us know, as mastitis can lead to the collection of pus in the breast, and this is known as abscess, and this might need to be drained if it develops. Okay, so this was all about mastitis. If you found this helpful, please subscribe to my channel and share with other people who might need it. And I'll see you soon with the next video.